Hello, I'm Jeremy Taylor. Along with Naomi Chambers, I'm the co-author of Organising Care Around Patients. I say co-author, but most of this book is not by us, but by about 20 patients and carers from all walks of life who shared their stories with us. These are varied and sometimes powerful accounts of their experiences of receiving care from the NHS, the good, the bad, and the ugly. Naomi and I were privileged to be able to hear these accounts and to weave them together into this book. I've worked for a number of years as an advocate for patient-centred care and for citizens having a stronger voice in decisions about health and care. The NHS does great work, no more so than during the COVID-19 pandemic, but it's not always so great at listening to those who use its services and then doing something about it. This is a book designed to help people involved with the NHS to listen better. It invites you, the reader, to put yourself in the patient's shoes and to reflect on how you could make your own practice more patient-centred, kinder, more attentive, more empowering, better organised. So whether you're a clinician, a manager, an academic, or indeed a patient, this book will have something to say to you. I hope you will read Organising Care Around Patients and be inspired by it. You can order copies through the publisher's website at manchesteruniversitypress.co.uk. Thanks for listening.
Hello, I'm Naomi Chambers. Along with Jeremy Taylor, I'm the co-author of the book Organising Care Around Patients, Stories from the Front Line of the NHS. What we've done is to compile and curate 25 accounts from patients from along the whole life course from birth to death about their experiences of care from the NHS in England. We learn from these stories about the consequences for patients and their families when care is fragmented, and the huge physical, emotional, social and psychological benefits when the care is truly person-centred. We open with a chapter about all the policies and initiatives that have been designed to organise care better and how difficult it has been to implement these, despite the best endeavours of healthcare professionals, managers, civil servants and politicians. We then present true accounts told in the storyteller's own words in separate chapters about pregnancy and childbirth, children's health, adult acute care, living with long-term conditions, mental health, and older age and end of life. Some of the stories will read as unbelievable, others as uplifting, and yet others as concerning. They all have something to say about what it's like when the NHS gets it right, or could do better. Each chapter ends with a series of provocative questions which arise from these narratives. We finish by reflecting on the principles that we think emerge from these stories for care that is truly organised around patients, and a call to action to reframe ways in which care can be provided in a better, kinder, differently organised, post-pandemic NHS. I hope you will read Organising Care Around Patients and be inspired by it. You can order paper copies through the publisher's website at www.manchesteruniversitypress.co.uk, and it's also free to read online. Thanks for listening.